Lisa Broyles here with Way to Health MD, and this is my second video on Retatrutide. So last video I talked about the Triumph trials, what the data is showing, how this medication works. This video is about the price of Retatrutide. There is always a biological cost when you have a powerful drug like Retatrutide. So I'm going to talk about what those costs are, and if you are someone that feels like this is a drug that you need, you can talk to your doctor about it. Again, this is not FDA approved at this time, but coming in the near future. I want you to be informed and be smart and know how to use this safely if appropriate for you. So let's dive right in. Retatrutide stimulates the GIP, the GLP, and the glucagon receptors. This causes thermogenesis. This literally melts fat, but it also burns muscle, increases heart rate, and has the possibility of lowering our mood. How does this happen? Let's just start with the mood, okay? The medication affects the nucleus accumbens, which is what helps us have dopamine, and dopamine helps us to feel joy and pleasure. So if you are not making as much dopamine, then you may experience more of a flat mood, less joy, what we call a flat affect. So this is a possible side effect of Retatrutide. So what can you do about that? Make sure that you are surrounded by friends and family, that you are spending time with people that you love, doing things that you enjoy. You shouldn't be working yourself to death. You should be spending time on you, on nourishing you if you're going to take this medication. If you are noticing, or your family is noticing, a decrease in your pleasure, your mood, more depression, then talk to your doctor. Your dose needs to be decreased, or you need to stop the medication. The next thing it can do is affect your heart rate, and it does this by hitting the glucagon receptors in the heart in the sinoatrial node. Your sinoatrial node is your master switch for how fast your heart beats, okay? And when you stimulate it with glucagon, you increase the heart rate. So when you increase thermogenesis, you increase your heart rate. So the studies are showing that at a dose of 9 to 12 milligrams, we are seeing an increase in heart rate of 7 to 10 beats per minute. So if your heart rate normally is at 70, 75, which is what it should be at, it may be 80, 85, okay? And an increased heart rate is generally not a good thing. So patients that won't be able to tolerate these medicines are people that already have tachycardia, atrial fibrillation. If you have a known arrhythmia, I would advise against taking this medication. So if you take this medication and you notice that your heart rate is going up, you need to decrease your dose, talk to your doctor, you may need to discontinue it. The third thing is something called sarcopenia, or muscle loss. So as the glucagon receptors are burning fat, unfortunately you are also going to burn muscle. So if you lose 50 pounds, you don't want 25 pounds of that to be muscle loss, okay? So what can you do to prevent this? And the answer is increase your protein intake in your diet, especially leucine. I'll talk about what foods contain leucine and a supplement that I recommend with leucine. Third, you need to do resistance training. I didn't mention in the last video that those Triumph trials aren't just giving people Retatrutide at escalating doses. Yes, they did that, but they also counseled them to exercise at least 150 minutes per week, including resistance training. They also counseled them on a healthy diet, not just cutting calories, but eating macronutrients, nutrient-dense foods. So leucine is a key amino acid that tells your body, hey, protect this muscle. It's going to stimulate muscle growth and at least protect muscle from being broken down. So you need to make sure that you are getting 2.5 to 3 grams of leucine with every serving. So 9 to 12 grams of leucine per day. So roughly 3 grams of leucine with each serving to prevent muscle breakdown. So now you're going to ask, what foods contain leucine? Glad you asked. So the most common are your animal proteins: whey, chicken, beef, fish, eggs. So if you're a vegetarian, there is leucine in soybeans, lentils, and peanuts, but it's much less, and it doesn't activate the muscle protection as much as the animal protein. So if you are a vegetarian, you must supplement leucine in addition to eating soy protein to prevent muscle breakdown from this medication. For vegetarians, 1 cup of soy contains 1.5 to 2 grams of leucine. So you would literally have to eat 2 cups of soy in 1 serving to equal the amount of leucine you need to protect your muscles, okay? Also, whey protein. So whey is a byproduct of cheese production. It's in a lot of protein shakes. 1 scoop of whey, which is 25 grams, equals 2.5 to 3 grams of leucine. So if you do eat meat and cheese, then you can easily get enough leucine by, say for breakfast, you make a protein shake with 1 scoop of whey, check that box, you've got enough protein with that shake. And then at lunch, you have a chicken breast. Well, a chicken breast is 3.5 to 4 grams of leucine. So that chicken breast gives you the leucine you need. And then at dinner, you have a 6-ounce fillet of fish. Bam, you're there, 3 to 3.5 grams of leucine. So you can have 6 ounces of beef and it will give you 3.5 to 4 grams of leucine, okay? 3 eggs contains 1.5 grams of leucine, so you would literally have to eat 6 eggs. That's a lot of eggs, but hey, if you can eat 6 eggs in a serving, that gives you your 3 grams of leucine. And then 1 cup of cottage cheese also gives you 2.5 to 3 grams of leucine. For vegetarians, what supplement would I recommend for leucine? You can get it in powders that say branched chain amino acids, or BCAA. So branched chain amino acid supplements like pure encapsulations, 1 scoop is 1.5 grams of leucine. Okay, so you could combine that with a cup of soybeans, edamame, whatever, tofu, and then you have the leucine that you need to prevent the muscle breakdown. I've talked about resistance training in my other videos. Please refer to my complete bone and joint health plan for resistance training. You can see Dr. Nikorsky or Dr. Whitstein and talk to them about your different ways of managing your resistance training. Read their book. So also, I would also recommend adding creatine powder to your BCAA powder to get the maximum muscle growth and prevent muscle breakdown from Retatrutide.